Endometriosis is a common medical condition that affects about 1 out of every 10 women. Technology and medicine have made it possible to reduce the symptoms of endometriosis. This patient education lesson will help you understand endometriosis better and review some treatment options. Anatomy. The female reproductive organs include the vagina, the uterus, the fallopian tubes, the ovaries. The female reproductive organs are located in the pelvis, between the urinary bladder and the rectum. The ovaries have two main functions. 1. The production of specialized hormones, such as estrogen and progesterone. 2. Ovulation, which is the release of eggs that are needed for reproduction. The hormones produced by the ovaries are very important in keeping ovulation regular. These hormones also prepare the inner lining of the uterus to proceed with a pregnancy. When an egg is released, it goes down to the uterus through the fallopian tube, where it may be fertilized. If the egg is not fertilized, the egg and the inner lining of the uterus are discharged to the outside of the body during the menstrual period. The uterus is pear-shaped. It is about 3 inches long and it has 3 layers. The inner layer of the uterus is called the endometrium. Once a month, if a woman does not become pregnant and the ovaries are functioning correctly, the endometrium is shed to the outside of the body during the menstrual period. As menopause approaches, periods become irregular and eventually stop. Menopause occurs when the ovaries quit making hormones and releasing eggs. When a woman gets pregnant, the fetus stays in the uterus until it is delivered. The uterus is able to expand greatly in size. The middle muscular layer of the uterus creates labor contractions, which cause the baby to be born. The outer layer of the uterus is called the serosa. The lowest part of the uterus is called the cervix, which opens into the vagina. The vagina opens to the outside of the body between the urethra, which is the urinary bladder opening, and the rectum. On the inside of the body, the 2 fallopian tubes go from each side of the uterus to the ovaries. The uterus is held in place with ligaments that help to prevent it from slipping down into the vagina. The urinary bladder is located in front of the vagina and uterus. The kidneys drain urine into the bladder through 2 tubes called ureters. The intestines and the rectum are located above and behind the vagina and uterus. The pituitary gland, which is located at the base of the brain, controls the ovaries. The pituitary gland secretes hormones called LH and FSH, which cause the ovaries to secrete their own hormones called estrogen and progesterone. The pituitary gland is controlled by the hypothalamus, a small area in the brain located just above the pituitary in the center of the brain. The hypothalamus secretes a hormone called GnRH, which causes the pituitary gland to secrete its hormones. Causes. Endometriosis occurs when endometrial tissue covers parts of the serosa of the uterus, the outside of the colon, the bladder, and the lining of the abdomen. This endometrial tissue is the same as the tissue that lines the inside of the uterus. During the menstrual cycle, Misplaced endometrial tissue goes through the same changes as the endometrium in the uterus. This leads to any of the following symptoms: cramps, pain in the abdomen, pain during urination, pain on passing bowel movements, back pain, pain during sexual intercourse. Symptoms of endometriosis may occur during the menstrual period or at any other time during the menstrual cycle. Over time, scarring may show up in and around the pelvis, ovaries, and fallopian tubes. This scarring can prevent eggs that are released from the ovaries to make it into the fallopian tubes, which could result in infertility or the inability to get pregnant. About 30 to 40% of women with endometriosis have fertility problems. Infertility may be related to the scarring around the ovaries and fallopian tubes. Researchers are not sure what causes endometrial tissue that is usually inside the uterus to be outside of the uterus in the pelvic cavity. Some think that during the menstrual period, pieces of tissue may flow back through the fallopian tubes into the abdomen instead of going to the outside of the body through the vagina. Diagnosis. To diagnose endometriosis, the gynecologist must take a very detailed history of symptoms. He or she will need to know exactly where the pain is felt, what kind of pain there has been, and its timing in relation to your menstrual cycle.